Hello, namaste, everyone. I'm Bindu Madhav Kerur. I welcome all of you to this great fireside session hosted by Sewa International USA in collaboration with Sarvamoola Foundation, Bangalore, India. During this tough time of COVID-19 pandemic, both the organizations organized a couple of sessions in the past related to crisis management, health, wealth management, and Sanskrit Sambhashan Shibers, and also on the Yoga Mitra sessions. At this time, we are organizing a fireside chat session from the two experts, more in an interactive manner. The topic of the session is how one should be protect from COVID and get the best care if one get infected. So I'm delighted to introduce the speaker for today's session, Dr. Ramamurthy, Bangalore. He is called Dr. Ramamurthy in USA, but in Bangalore, and then he's also called as Ramamurthy in Bangalore. So Diplomat of American Board of Internal Medicine, a Diplomat of American Board of Pulmonary Diseases, and a Diplomat of Sleep Medicine, and many more. And I will have our moderator describe more about him. He's also part of many Kannada Kutas and also social organizations. We really thank for his time and interest for making the session. To moderate this great session, we are fortunate to have Dr. Anurag Mairal ji. He is actually a Sewa USA Bay Chapter President. He's instrumental in conducting various innovative programs, things like design to lead programs for youths in Bay Area. Professionally, he is a lead faculty at Great Standard Byers Center for Biodesign, and director for global outreach programs and many more. He's associated with many more social organizations, and he is also a series entrepreneur. I'm sure this webinar will set a solid ground for maintaining a healthy lifestyle. Sewa International's Know Your Healthy Self program is an initiative to encourage physical fitness and the development of a balanced lifestyle. The SELF, S-E-L-F, stands for S for sleep, E for exercise, L for living in the present lifestyle, F stands for food and diet. Okay, so with this introduction, I'll also have one small note for all of you, the viewers on the Facebook. If you have any questions, please send it to our Facebook live chat window. Our volunteers will help them to pass it across to the moderator, and we'll try to answer them. Without any further wait, over to our moderator for today, Dr. Anurag ji.
Dhanyavad, Bindu Madhavji. What an honor and a pleasure to be here, Facebook Live with all of you. We have, as Bindu Madhavji said, a great session planned for us today. It's possible that we may actually have a series of these in the coming months, because we realize that this is a pretty significant a pandemic that is impacting all our lives, and many of the questions that have come up as we were planning for this event, and we are requesting questions from everybody. We realize that the scope of questions is pretty broad, and one hour of discussion will probably not cover it. And we do know that the pandemic is evolving, its therapies are evolving, and things are getting worse in some of the geographies. So we would like ourselves to be available to you for those questions. So we may have a series of these in the coming months. So look out for that. So with that preamble, let me just quickly mention a couple of things about our speaker today, with whom I'll be doing the fireside chat, Dr. Ramamurthy, who's a pulmonologist, essentially by training, with a number of different sort of specializations that he has been trained in. So he has seen this pandemic firsthand. And a little bit about my background, just to add to what Bindu Madhaji said, I'm a faculty at Center for Global Health, and I'm also involved in medtech innovation. So this pandemic has been a really significant uptick of activities of my students and my colleagues here from the global health perspective, public health perspective. We're hoping, Dr. Ram and I, to bring the net sum of our experiences and our knowledge to you. We'll try to make it as palatable and as sort of accessible to you all in the way we present it. But there may be times when we may end up using technical or clinical terms. It'll be mainly to make sure that we have solid, scientifically based information available to you, but we will sort of translate it to what it means for you. So we'll do that. Just a couple more thoughts before we jump in, and I invite Dr. Ram to share his thoughts. This has been probably the most impactful, in the negative sense, event in our lifetime, probably many lifetimes. This is probably a bigger, more impactful event, given how well connected the world is today, than even the 1930s, Wall Street meltdown in the U.S. and potentially even the Second World War, for a number of reasons. And again, I don't want to go into the details of it, but this is really, really impactful for all of us. It has touched every single region in the world. 200 plus countries and territories are impacted by it. As we speak, 50 plus million people have been infected. 1.2 million plus people have died. I just saw the data for the US. Yesterday we had 200,000 people that were infected by it. In India, numbers were looking better, but starting to get worse in some of the geographies in India, some of the regions. So the upshot of all of this is that a lot of lives have been disrupted economically, socially, but a lot of lives have been impacted in terms of the healthcare as well. And it's important for us to, and it's not done. The point also is, as you'll see from the rest of the discussions, that we probably will be contending with this disease and its after effects for at least the next year, and potentially longer term than that. It might even become endemic that we may have to deal with over a period of time. So in the context of all of that, in light of all of that, the question that comes to the top of our mind is, how do we prevent ourselves? Because prevention is worth more than the cure itself. And then if you do get infected, how do you actually access the most optimal care for you or your loved ones? That is simply the gist of today's discussion. We will go through a number of different questions that I prepared, but I would very much invite all of you to share your questions, because this is for you and the concerns that you have that we would like to address. So with that, let me invite Dr. Ramamurthy. Dr. Ram, you have a long experience in the pulmonology field. You've dealt with a lot of patients in critical care settings and outside of critical care settings, and this must have been a pretty disturbing sight for you to see how this disease has impacted your patients and the communities that you serve. Maybe you could share to just kickstart us in this discussion. What do you think about this pandemic, its impact, and what your personal experience has been since the beginning of this pandemic in early this year, Dr. Ram?
Thank you very much. Thank you for having me today. It's my honor and pleasure to be a part of this great organization. I want to say good morning, good afternoon, good evening, and good night, because we are covering multiple zones. So good morning here in California, good night in India. So I wanted to bring in up-to-date information on COVID and how to prevent it, what are the signs and symptoms, and what is new. So for this, I had to take you back a year ago. Actually, in month of January, I was in India. So January 29th, I took my Bangalore to Frankfurt to New York flight. I landed in New York airport, January 29th, exactly. So I have no idea what's going on. We are having a good time in India. So I landed in JFK airport. And when I was walking out of the airport, in the lobby, everybody was wearing a mask. And I even asked them, what's going on? So somebody told me, Air China landed in the same terminal before your plane landed. So I took it seriously. I covered my nose, walked out, and then I started to realize how bad it was, how everybody is getting affected. And, and those things are beginning stages of the disease, and we didn't know much about it. So over a period of time, I went back to work, and this story was still developing. On March 9th, a patient walked into my office. He used to work in New York, and he says, hey, my new employer wants me to get checked up for a virus and blood work before I go back to the new job. So at those things, we didn't know. He has no symptoms, he's not wearing a mask. Nobody was wearing a mask in March. So I sent him for the test. God behold, the report came back positive. As soon as I heard about his report is positive, first thing I did was I went on quarantine. The reason I'm telling you this story is I tell you this story and I expect you to do the same. If you think if you're exposed to somebody with COVID, quarantine yourself for 14 days. What is quarantine? Quarantine means you go home, stay separately, stay away from your family, even if avoid close contacts. If you really have to sneeze, sneeze into a handkerchief, and if possible, wear a mask and make sure you're totally separated for a while. Also, check your body temperature, check any symptoms. Also, please keep in touch with your doctor. So I went on quarantine for 14 days, and then everything went well. I was concerned. Even though I'm a doctor, before I was a doctor, I'm a human being. I also think about, hey, what will happen to me? What will happen to my patients? Over a period of time, I got over the symptoms. I did not have any symptoms, but the fear of having is worse than the disease itself. What I mean is, if you think you're having it, start worrying about it. So COVID, yes, it's a respiratory virus. People get it as soon as they're exposed, or if you are within a 6 feet distance, and it is because of aerosolized. If they sneeze, it can fly in the air for a while. And if you are, in fact, if you're not wearing a mask, or if you are very close to the person, probably there is exposure. At the same time, I want to bring up a topic, what's known as asymptomatic carriers. What is asymptomatic carriers? That means a group of people may have a disease. However, they don't have any symptoms. They're walking around doing everything they can. However, they can transmit the disease. Right now, let's talk about prevention, and then we'll come to the next step. How do we prevent this? Yes, it's highly infectious respiratory disease. We want everybody to wear a mask, keep 6 feet distance, hand washing, very important. And also, if you have any signs and symptoms of COVID-related illness, we want you to isolate yourself, quarantine, and prevent you getting exposed to other people. Question comes up, hey, how many days is quarantine? Standard is 14 days, okay? Even if somebody is traveling from country to country, most of the international law is, if somebody is exposed to COVID or suspect COVID, usually we want them to be isolated for 14 days. So remember 14 days if you think you have been exposed. Number one, let's prevent an exposure by wearing masks, using hand sanitizer, and keeping a distance, and avoiding a very closed space where a lot of people sitting at the same time. And I will also touch upon, in case some people have COVID. So if you have 100 people have COVID, please remember, everybody is not going to get in trouble. Only 15% are more likely to get a disease-related issues. Remaining, out of 100 people, 85% will have symptoms, like mild symptoms, a fatigue, maybe a low-grade fever, a loss of smell, or they may feel uneasy. Some people also have episodes of vomiting and diarrhea. So most of them, 85% of the patients who go through COVID illness are mild to moderately symptomatic. However, 15% can have long-term deleterious effects. What I mean? Again, you have to look at the age group. if anybody after the age of 50, 55 with underlying medical illness, please, they need extra care. Somebody who is a smoker, who has a significant lung disease known as chronic obstructive pulmonary disease, a smoker who is also at a risk, because these viruses affect the respiratory tract. So the other things we also found out was there are sometimes when the people are really sick, they may need oxygen, they may need ventilator and other medication. With being said that, because of fear of having a disease, by being afraid of having a COVID, some people will have a lot of psychological symptoms like angry, depression, and not having proper sleep. So people do go through insomnia. Insomnia means not sleeping well, or being angry, being depressed. So there's also a psychological stress. Because if you look at the younger population who go to school, they've been partially quarantined at home, in the sense they're not allowed to go to school, meet their colleagues and friends and wear masks. They are also under a lot of stress. So if you have small children at home, please consider to them, please read through their mind, support them, explain to them why you are doing all these things. For the kids to understand this concept takes a little longer than adults. Even adults are difficult. So just imagine, kids can be further difficult. So take your time to explain to the children, depending upon their age group. I don't want you to scare them. However, make sure a proper education, knowledge will take you to a higher level to prevent the disease, also to take care of the issues if things need it. I will stop here. I'll wait for Anurag to ask me the next question.
That's an excellent summary, Dr. Ram. That contains many, many layers, and I'm hoping that audience is able to sort of get the gist of many of the points you made. And I'm going to be pulling on those threads throughout this conversation. I have at least 122, 123 questions that have come up through different sources in the last few weeks. So we're not going to go through all of them, but let me actually start with the first group that relate to transmission, Dr. Ram. So when this pandemic started, it was known that it's a disease of the airway. That was a belief, that it's the respiratory illness. The route was primarily macro particles, the big particles that remain in the air for maybe a few minutes or so, and surfaces. So the precaution that everybody was recommending, including the WHO at that time, was don't touch things, clean things up, don't be in very close vicinity of people. Mask wearing was also not that heavily being proposed at that time. But as the pandemic evolved, it started to become clear that it's the microparticles that are aerosolized that could also be playing a role in actually being in the air for tens of minutes. And then if you're in the vicinity, even 6 feet apart, if you're not wearing masks, there's a likelihood that you might get it. And the mask mandate came up. Mask recommendation came up. In some places, was mask mandate. And just yesterday or day before yesterday, I read an article which asked the question: when we know that everything is airborne and the most primary mode of transmission is airborne, why are we still cleaning the surfaces? So my question to you, Dr. Ram, is: are all of these modes of transmission still valid, and they're still something that all of our listeners, our viewers, should be concerned about, or should they start to take it easy on some of it? Should they stop cleaning their vegetables then when they bring in from outside, or should they stop cleaning the boxes, the Amazon boxes or shipping boxes that come into their homes? Would you say that they should start taking easy on any of these fronts, or would you say maintain the same level of vigilance?
You brought up a great question. At this moment, wearing a mask is still important. Please, please, please. Always keep a 6 feet distance, number one. If you don't keep 6 feet distance, if you get COVID, if you're really one of those guys who really get sick, you'll be 6 feet under. So it's better to be 6 feet apart than 6 feet under. That's number one. Two, wearing a mask is basically protects you both ways. Now, in case you're an asymptomatic carrier, say I'm wearing a mask, in case I'm an asymptomatic carrier, I will not be giving it to another patient. I may not have symptoms, but I may give it to other people. So using a mask prevents you getting the disease, as well as if you have it, if you are an asymptomatic carrier, you will not be giving it to the other people. At this time, isolation, 6 feet distance, not getting close to each other, hugging and kissing, very close contact. If you can avoid that, that will prevent the progression of the disease. When a pandemic or epidemic like this, if a lot of people are infected, one person passes it on to the other. If you can cut the chain at the right moment, the transmission rate will come down. Over a period of time, there is a herd immunity so that we will be able to face the disease, even or the disease may be less infective. We really don't know how it's going to work, but we'll be hoping for it. At least we'll have more knowledge to take care of the disease and viral illness. Next question was, what should we do with the vegetables? Amazon drop boxes. I preferably, what I do in my house is I will keep if somebody drops Amazon box, I'll keep it outside the door for 45 minutes to 1 hour. For my own conscience, I spray something on the top, I wipe it, I bring it in. However, I will not ask them to deliver inside the house. 2 reasons. Number one, I don't know the driver of the Amazon, he has something, or he may be carrying, he may be wearing a mask, or he's being to multiple places. So at least I keep it outside for 45 minutes for 1 hour, and then I try to bring it inside. When I go for shopping, the most of the vegetables I bring in, I keep it in the garage for 1 hour, hour and a half, and then come home, wash my hands, and take care of this. However, in case I'm taking care of a person who has COVID in a hospital setting, I have my own protocol. I go wear a mask. I will show you a mask later, where we can only breathe very cold air. However, we are not breathing the outside air. A lot of few masks came to the use of doctors and nurses, and I do carry one. In case I go to a hospital, I wear that mask. So my exposure from the other person who has COVID is less likely for me than, if I don't wear that headgear or the mask and special kind of mask. However, even if I come home, first thing I do is I leave my clothes in the garage, I take a shower, because I want to protect me, protect my family, and also protect my patients. So at this time, as much caution you can use. As a layman, stay 6 feet apart. If you have an infection, quarantine yourself. Wear mask to prevent passing the disease to other person, as well as getting it from the other person. Next, if you are in the healthcare professional, please use the maximum care and make sure you give the maximum attention so that you don't bring a disease from a hospital to your own house. Again, it can be done. I'm doing it from last 1 year. So far, I'm very successful. I promise you, having a social distancing, wearing masks, wearing appropriate gadgets can prevent the disease. And also, we can put an end to this virus, which is replicating enormously. Thank you.
Thank you, Dr. Ram. That's an excellent comprehensive response to that. You were talking about mask, and I remember there was quite a bit of debate in early days and about the mask. And first it was not recommended, and then it was recommended. Now it's almost mandated. Hope the new administration will actually mandate it nationwide in the U.S. And the question that kept on coming up is that the N95 mask, which is the most advisable mask, which captures 95% of a certain particle size, there is a shortage of that N95 masks. And I'm at Stanford Healthcare, Stanford Medicine, and most of those masks, N95 masks, are safe for healthcare workers because they're taking care of the patients who may potentially have the disease. So there has been if you go online and if you try to buy N95 masks, those are clearly not available. But KN95 masks or N94 masks from Korea, multiple options are available. The question that I want to ask you is that there are places, for example, many of our listeners or viewers are from India, where some of those masks may or may not be available, especially if you're from a rural area or lower economic segment folks like, the maids and so on. They can't afford many of these masks. What would you say to all of our viewers and listeners? What is the best mask to wear? And should you be wearing multiple masks? Is cloth mask okay? What should be the protocol for using the mask and then cleaning it, or letting the viral layer sort of disintegrate if the need be? So two questions there. What sort of mask should everybody be buying? Or if they cannot buy, what sort of masks should they be using? And what's the approach to using those masks? How many times can you use a mask?
It's a difficult question to answer, but I'll do my best. Yeah. If you're a healthcare worker, if you're seeing a patient in a hospital setting, or you're a doctor or a nurse in a hospital or office setting, probably you have to use N95 mask because you're trying to prevent a disease, neither you getting it, neither you are giving it to other person. Or usually what I practice in my office is as follows. We used to put all the patients in the past, in the waiting room, not anymore. So I did my own way of dealing with situation like this. All of them will be waiting downstairs in the car. We call them one by one. We check their temperature in the door. We take them directly to the room. We are wearing masks. They are also wearing the mask. So we are exposure to person. In an office, it could be 10 patients sitting at the same time. One may have it. Who knows? I don't know until we check them out. So we avoided close contact with even the patients. They called one by one. They come out of the car, come directly to the locked door. We open the door, check the temperature, ask the question, take care of their illness, and make sure. So wearing a N95 mask, yes, this is very difficult to find one. However, what do you do with a common man in the field? He does not have resources. He does not have finances to buy. I personally believe something is better than nothing. Take a handkerchief, fold it, put it around your face. Use your sari or your panche, something to cover on the nose so that whenever you sneeze, in case you have it, the aerosolized particles will not fry apart. And again, you are not exposing something. Something is better than nothing. However, it's very difficult to reach all this high intensity, expensive mask. To reach a common man could be difficult. We personally believe, use your judgment, use your imagination, come up with a device which can prevent aerosolized exposure to virus. For example, if you sneeze, if you're on a day when there's a big sunlight, when you sneeze, you can see the particles fly apart up to 6 feet. So if you put a handkerchief and sneeze, probably the particle will stay there. So I personally request, use a handkerchief, use some kind of a mask. Any mask is fine. Something is certainly better than nothing. You can't be affording to get N95. You may not be able to get it. Again, those things has to be required for the people who are in the healthcare facility who needs to do this on day-to-day basis.
Yeah. No, the great answer, Dr. Ram. What the one key takeaway from what you said is that, what you're trying to do is minimize the likelihood. This is the game of odds, and you are increasing the odds of getting the disease and passing it on if you have it, if you don't wear masks. And what you're doing is every single precaution that you take, every single layer that you put on of precaution actually cuts those odds, that probability down substantially. And that's your recommendation, and it's a great recommendation. But something is better than nothing. So excellent point there. There are questions that basically relate to. Let's switch gears now from prevention to what happens when you get it and you're really trying to protect your loved ones. You said something in your opening remarks that if you get it, you should isolate yourself. Now you're in the same household, depending on how big your home is, you could potentially have a room and you could kind of close yourself in. But the air circulation within the house there's a common air, and this room is not isolated completely. The air is not separated out from the rest of the house. And then of course, you're eating food and you're getting food utensils and so on. How does someone who has been infected by COVID-19 protect his family members or her family members from getting them exposed while quarantining or isolating in the same house in a different part of the house?
Okay, basically a question is, if you think you're exposed, quarantine, it does not mean you have the disease. So suppose I walk into the hospital without knowledge, I was exposed to somebody, I come back home, I will quarantine myself, I wear a mask. And I'll tell my family members also to wear a mask until unless that 14 days period is done.
Mhm.
Now, question is, yes, you have COVID, you're at home, you are kind of a little malaise, little aches and pains, little fever, little uneasiness, but you're not sick enough to go to a hospital. Again, I told you, out of 100 people, 85% of the people will do better at home with supportive care. I will advise following things. I will try to answer the first part of the question. I'll go to the second part later. First part, isolate yourself. Yes, utensils, you can keep it separately, even though it can be spreading. If you think you're already infected with COVID, you are on supportive medication, we are very, very sick, you're not really short of breath, your oxygen level is good, and you're not infected or septic. We use the word sepsis. Sepsis means you are very dizzy, you are having low blood pressure, and you are pale and extremely short of breath. At that time, yes, you need help from the hospital setting. Now, right now you're okay, you're eating, watching TV, you're using WhatsApp, you're talking to your friends, nothing bothers you, you're doing your computers, you're eating well, maybe your appetite is a little low. What I recommend is you keep some separate utensils for food. Keep it in your room. And after 14 days, after the illness passes away, it can be part of the family. However, those 14 days until you get better, we want you to use mask. Also ask the family members to use the mask and avoid close contact. You can always call them on the phone, talk to them rather than talk to them face to face. Can air conditioning, air circulation can spread? There is a possibility, but chances are less. As long as you're 6 feet away, I'm happy. That's the way I look at it. And wear a mask and keep separate utensils and keep your clothes separately from other clothes. And once after 14 days, once everything is fine, clean this room perfectly so that if there is any leftover viruses, bacteria anywhere, you should be able to clean up the place better. I'm not saying when somebody is sick in your family, we need to give a moral courage to them. Do not isolate them, saying that, oh, he has COVID. I don't know you. We don't do that. Take care of them passionately, compassionately, and make sure you support him. And this is a temporary illness. 85% of the people will do very well within 10 to 14 days. That's the reason we keep that 14 days. However, please contact with your primary care doctor who will be able to guide you through the medications. Other thing I strongly recommend is, in case you think or you have a diagnosis of COVID, you're mild short of breath, please remember what is known as prone and supine. If you sleep on your belly, this is the head, you sleep on your belly, your oxygen level is better. There are different zones in the lung known as WEST, W-E-S-T zones. So the circulation in the lung is different in different parts of the lung, upper lungs, lower lungs. So if you lay on your belly, your oxygen level gets better. So I still recommend that even in the hospital, we do that prone positioning for a person who is little short of breath. So sleep on your belly, it will improve your oxygenation if you have COVID at that time. And then make sure you take care of your nourishment, hydration, and make sure you're not starving. Make sure take your medications. And also if you have any underlying illness, diabetes, high blood pressure, do not ignore your original medications. So people who are underlying diabetes, underlying immunocompromised, they are more at risk to go through a lot of complications from COVID rather than a healthy person. So elderly people, please keep an eye. Number one, hydration is important. Two, the medication they take them on a regular basis, make sure they take it appropriately. Anytime you have a question, please talk to your doctor. They are there to guide you. Thank you.
Thank you, Dr. Ram. Just one quick comment and one question, and there are several questions that are coming from the audience, so please keep them coming. Those are very helpful to guide our discussion here. One comment that I wanted to make was that this virus, so this is a virus. Virus is not neither a living thing or not a dead thing, but it is a biological organism. The thing to keep in mind that it's got a lipid layer on the outside. That's the unique thing about this coronavirus. It's a novel coronavirus. And soap is a very effective way to disrupt that layer. What you're really trying to do is disrupt the layer of virus that may be on objects, in terms of surfaces and so on. And when Dr. Ram said, keep your clothes separate, keep your utensils separate, it is with that in mind. But if you keep on disrupting those layers by washing your hand regularly enough, without touching your nose, without letting yourself get exposed to it too much, that's one way to cut the odds of you getting it. So that's just wanted to highlight why Dr. Ram is recommending the steps that he is. I have a question, and there are a number of questions that will build upon that, Dr. Ram, is, this has been a very difficult time for families, both in India and here in other parts of the world, where people have not been able to do their daily things that they normally did outside. There's social activities, their leisurely activities. They're not able to go to work, so they've been isolated at home, and that has an effect on the mental health, which I'm going to come back to later on. But one of the biggest questions that parents have is, what should do they about kids, whether they are young kids that are going to preschool or they're college-going kids. There is this almost like a dichotomy. On one hand, you want your child to go and learn, and this is also a difficult thing for the kids to stay home cooped up. It's for their mental health and so on. At the same time, there's this fear that these kids may become carriers, even if they have mild symptoms, or they may have long-term effects on their health, which I'm going to come back to you later on about. What should parents do about their kids? Should they send their kids to school, or should they keep them home?
It's a great question. What I always believe, if you preach something, you should also practice. So I kept my hand wash here, okay? So always, this will take you a long, long way. So every time I walk into a patient's room, I wash my hands, number one, with water, also with soap. It really, really, really prevents. Not only you are getting it, also in getting it from the other person, you are also protected. Apart from that, we do wear gloves also, but we don't put the soap on the gloves. First we hand wash with the soap, then you put the gloves. So we are less likely to get infected from the other person. The other question is, this Corona has put a lot of mental stress for all age groups, okay? Children, they are allowed to play. They want to play, they want to go to school because they want to play at least 30 to 40% of their time. They want to meet their friends, circles, and other things. It is so difficult, and the kids do not follow the guidelines as good as adults, okay? They're not ignorant, even though I can say that partially ignorant. Right now, coaching from the parents, relatives, and the teachers. Hey, this is an illness. You can't take it lightly. You have to make sure you take care of this. How do we improve the mental health? I probably believe, suppose, even if you, in India and other places, there are opening the schools and colleges, and however they keep 6 feet apart, number one. 2, limited number of people are coming to the schools and colleges. They do check their temperature at the door, as well as use the hand sanitizer. Number one, at least you can't be there talking to them face to face. At least give your telephone so that they can talk to each other. At least you'll take care of that mental pressure of being alone. So at least ask them to get involved. Again, I'm not saying that give them a computer, laptop, or a tablet or anything. However, use your judgment. Everything too much is too much. However, they should also get engaged in conversation, talking to his friends, close friends, sharing their thoughts. They probably think differently than adults, okay? They think the adults are controlling them. However, you have to understand their maturity of mind at their age group. So basically, don't ban them from talking to anybody. Allow them to talk to them. Ask them to use computers, tablets, laptops, whatever is necessary to talk to their colleagues and also class teachers. In USA, some of the classes, or even in India, it's run on computers. Basically, the teacher will hold a class for 20 people, will have question and answer sessions. The question is, yes, it's good and bad. Good is, yes, we have something going on in a situation like this. The bad is, listen, the amount of energy, amount of thrill you have in a classroom is totally different instead of sitting in front of a computer. So I personally believe, wait, things will change. Wait for the vaccine. We'll talk about that soon. It will be changing. And I'm very confident, maybe next 6 months down the line, everybody is in a better shape and we'll be able to deal with this illness in a better fashion. Meanwhile, children, make sure they do get their sleep. Important. Sleep in children is very important. They're so busy. Don't give their computer or a laptop and they'll be keeping it open until 1 in the morning and they will not sleep. And next day morning, they will sleep in the classroom because they do need sleep, which varies. Adults, we need about 6 to 7 hours. If you go younger, the children, they need more sleep. If you have a baby born, babies sleep for 18 hours, that's normal, okay? As you go to a primary school, you do need 10 hours of school. 10 hours of sleep. So there are big issues in USA where the schools were used to open at 8:30 in the morning. However, the children were still half asleep when they go to school because they didn't finish that 10 hours, 8 to 10 hours of sleep. So early to bed, go early to bed so you can get up by 6:30, 7, so dress up and go to school. And there are some places, some of the counties, they made a change in the school system. Instead of opening at 8, they open at 9:30 so that the children have enough sleep before they come to the school. So right. Sleep is important. Once you take care of the sleep, the rest will fall in place. Sleep is equally important for mental health, equally important for general health, especially when you have an illness. Sleep is very important. We sleep average 8 hours a day. That's 1/3 of a day. That is 1/3 of your life. When you go to a doctor, please talk about sleep because that is 1/3 of your life you're sleeping. For you have to be sleep well so that your brain works better next day. If you don't sleep well, the whole thing is a mess. So I believe the family support, having proper sleep, proper food, hydration, that will take them a long way and help the kids to get better and succeed in life. Yes, this is a setback. However, we are confident we are going to do well, and we will get over this over a period of next 3 to 6 months. However, we should not be ignorant. We should use still the social distancing, wearing masks, hand washing, and protect you and protect the community.
So Dr. Ram, we have about 15 minutes out of which I would like to save some time for audience Q&A, and there are a number of them coming. I just want to tackle 2 topics, which I don't think we'll be able to tackle in details today, but I do want to touch upon them, and our future session will dive a little deeper. Actually, three main questions. Number one, and I'll just frame them right now. Number one is about if you suspect yourself of having COVID-19, what's the diagnostic and testing process that you should follow? Because it seems like depending on what part of the way we are in, the testing is either easily accessible or it's not, and it actually takes up to sometimes in some cases several days before you find out. So what's the process we follow? That's number one. Number two is what are the therapies that are available both in India and here for COVID-19? From home therapies all the way to the drugs that are being used for treating the disease. That's a second question. What's the best optimal care protocol or treatment protocol? And then third question is about vaccines. When are the vaccines going to be here? And should you take it or not? And so it's a major question which we may not be able to deal with. So those are the 3 major area. So maybe you could, if you don't mind, if, over the next couple of minutes, if you could just frame your responses to these three at a high level, then we'll dig in.
All right. This is a loaded question. However, I'll do my best. Probably it takes 1 hour to do it, but I will streamline the thoughts and put things together. Number one, I'm not saying you're in USA or in India, wherever you are. Suppose you suspect, that means, hey, you may have COVID. What is the best test? Okay, a lot of people can afford, some people can't afford. Suppose you can afford, you can't afford. Now you can't afford. Now, quarantine yourself for 14 days. Most important, stay inside the house, cover yourself, hydration, eat well, and think if you have it, prevent it passing out to the other person and ask them to wear a mask. Now you go for a testing. You went for a testing, came back negative. Please don't jump out. Oh, let me go for a movie. There is what's known as false negatives and false positive. That means test could be negative. However, you can still have a disease. Again, I'm not getting into details of each and every test. What I recommend that is fine. If you have symptoms, think you have COVID, even the test is negative. Sometimes they may have to do it twice before we come to a conclusion. And it's not only the quality of the test, it may be the number of particles of viruses is so little in the initial phases, it may not be able to be picked up by the test. That's one. Over a period of time, you could have more particles of the virus particles that could pick up the test. So if you think you have COVID, stay home. Take 14 days of rest. Get the test done depending upon that. The most important next question was, again, 85% of the people do well. They can take some home treatment, some supportive care at home. They do extremely well. 15% of the people may need hospitalization, which can vary from oxygen, medications, antiviral drugs. So there are a lot of things in the market. Some of them have been tried. Again, we don't have all consolidated studies putting it together. This is better than this. This is better than this. However, in a hospital setting, what we do is comfort measures. Now, apart from comfort measures, we do give oxygen, high flow oxygen, and then sometimes we give a non-rebreather. There's a mask which blows a lot of air and oxygen into that. And some people may need a ventilator support to take care of their lung functions. Again, don't panic. Everybody don't get into that stage. People who have underlying issues as well as elderly, and it's only 10 to 15% of the people who develop COVID. However, out of them, 10% still get better. They come home. Remaining 5% can have other options. However, what I'm trying to say is, yes, prevention is better than cure. If you think you have exposed to COVID, stay home. If you can, make sure keep in touch with the doctor and check your temperature, check for any symptoms of shortness of breath. Always want, if you can, sleep on your belly down. It will probably help you for oxygenation to improve in the lungs. And also, if you have a high fever, please take some medications to bring down the fever. Please talk to your community doctor, who will be more than happy to help you out. However, if you are in the hospital setting, they have their protocol. Each hospital has their own protocol. I can only talk about in USA, depending upon what is medications is available, approved by the Federal Drug Administration. There is also big role of plasma exchange, which has been tried in the past. For example, somebody who had a COVID, he got better. They take the blood, separate the blood cells from plasma, and they give a plasma transfusion. It also been found to be successful. However, I don't want to say, yes, go for a plasma exchange. Every treatment has to be individualized. That's the way I look at it, number one. Number two, it also depending upon the local expertise, how they handle the care. That's two. There are centers in America where they do ECMO. It's a special kind where your oxygen level is low. They can insert a device by I'll use it for the lack of better terms, an artificial lung. Basically, it takes about your carbon dioxide, gives you more oxygen. So there are various options are available. However, it's very intricate and detailed and too much medical, which I don't want to bore you to death. those information. Being said that, again, please reach out for the your primary doctor if you're staying home. If you get into the hospital, talk to the doctors or talk to them various options, number one. However, I also want to bring, one of my specialties is hospice and palliative care. I have dealt with a couple of people who are 80 years old, 90 years old. They say, Doc, I lived enough. Leave me alone. Don't put me on a ventilator. There is also a role for it. If you believe you lived enough, your 80s and 90s, enjoyed your life, and you don't want to go through aggressive management, being on a ventilator, there is also what's known as comfort and passionate care. Less you do for them, they're happy for you. So depending upon each and every situation, yes, look for a cure. However, if patient has the autonomy, if he says, I'm 90 and 95, I had good life, I don't want to go through this, I don't want to be on a respirator, I think we should respect their views. So I'm not saying not to treat them. However, respect their views and do not enforce anything on elderly people if they decide to disagree with you and decide the way they want to have their lifestyle. So, make sense?
Yeah, well said, Dr. Ram. I think just want to encapsulate what you said. You actually captured all the three questions really well in your response. We didn't get to vaccines, but we'll do that in the next session. But I just want to summarize what you said. That's important is that it's a very complex disease. We don't know fully. Some people think it's maybe a blood-borne disease. Potentially, there's a blood coagulopathy involved, which means blood clotting. So there are a lot of different phenotypes of patient populations. So we don't, at this stage, we don't know everything there is to know about this disease. It's so new. That's why it's called novel coronavirus. Your recommendation is to, if you are mildly symptomatic or asymptomatic, stay home, use home therapies, keep yourself healthy, sleep well, take good care of your body and your mind. That's the recommendation. But if you are one of those 15% of people who do need hospital care, trust your doctors, trust your care providers. Again, be a constructive partner in that, ask questions, but the local expertise and the range of solutions that they may be trying is based on their experience. And at this stage, we don't know whether one is better than the other. So it's important to actually allow your care provider, your doctors to provide the care they feel is most needed. And in some cases, no aggressive therapy may be the best care they may need, the palliative care that Dr. Ram talked about. So great responses. One last question about vaccines, and then I'm going to hand it back to Bindu Madhurji with a recap. Should we, what do you think about vaccines? Are the vaccines going to solve the problem? Should we, how should we think about vaccines? When are they going to be here?
Okay. Number one, yes, vaccines. Yes. Question is, there are two kinds of, let me put it this way. Before I get into the vaccine, I want to tell people who are in USA, make sure if you're in USA, November, December is a flu season. Make sure you get your flu vaccine for two reasons. Number one, flu itself is an illness during the winter. COVID is already there. If you get a COVID and flu, it's a double whammy. So if you really have to take vaccination against flu, if you're able to get it, please get it. Very important. At least instead of two viruses at the same time, you can fight the other one. The vaccines are there. However, what is not known is, okay, fine, I get a vaccine today. How long I'll be immune from the disease? We don't know the answer. Question number two. Okay, I get a vaccine. Say, do I need a booster dose 6 months from now? We don't know the answer. So if you get a vaccine, how long the immunity is going to last? We don't know the answer. However, people are thinking probably 6 months. However, it's all preliminary studies. However, we will know once a lot of people get the vaccination and they monitor their antibody and immunity. And there are two kinds of immunity. One is IgG and IgM. One is acute, another is long-lasting immunity. They look at it and decide, is it immune? However, the other point which I was telling was, if a lot of people, what's known as herd immunity, 100 people got vaccinated, immunized, their immunity is built up, so they indirectly pass on to the community. It's known as herd immunity. So yes, vaccination is coming in. We don't know the answer. Do we need 1 shot or 2 shots? Number 1. 2, do we need it every year? We don't know. However, there are things in the horizon. Yes, it is coming. How far it can reach a common man, that's a big $1 million question. However, what they're planning to do is they want to give it to the healthcare workers, police, homeland security as a priority, and then they go to the elderly and the sickest of sick, or quote unquote, who needs a partially immunocompromised. They will get it before it reaches the large group of population. So it is there, but we will talk more during our next session regarding the vaccines and what to expect, and which is better. There's no answer because everything is a new vaccine, and hopefully we'll have some answers during our next session. Thank you.
Yeah, thank you, Dr. Ram. And I'll recap and then I'll hand it back to Bindu Madhavji. Just about a vaccine very quickly. Vaccines are arriving. Seems like results 90% plus efficacy. What does that exactly mean in the real world situation would remain to be seen. For most of us, the vaccines are going to be available no earlier than middle of next year, likely, because there are other groups that should get these first. So stay patient, and when it comes, you may want to take it. It is going to protect you, but we should plan for no vaccines until middle of next year. So, it's important for us to do all the other things that Dr. Ram said in terms of taking precautions, protecting yourself. Prevention is worth, an ounce of prevention is worth, a pound of cure, as they say, and that applies here really, really, really well. I'll just recap in a few sentences the discussion we had. Wear masks, protect yourself, take care of your body, your mind, the best you can, so that you keep yourself in a fighting fit position. Observe social distancing. Try and keep your kids, train your kids to follow the protocols as well. If you can keep them home, that's great, and distance learning is okay. But if not, if they do have to go to school, make sure that they are following as many precautions as possible. One statement that Dr. Ram made that really stuck in my mind: 6 feet 6 feet apart is better than 6 feet under. That really encapsulates the gist of the discussion we had today. We'll tackle a lot more of therapies and care protocols and vaccines in the next session. We are hoping to put all of this together in the form of a booklet that will ultimately be available to all of you after we are done with these sessions. So stay engaged. Please attend the future session because the topics are going to be different. The questions that many of the questions that we couldn't get to today, we'll get to them in that session. So with that, I'm just going to hand it back to Bindu Madhavji. Bindu Madhavji, it's all yours. Thank you.
Yeah. So first of all, thank you for conducting this wonderful session, the Fireside session. Thanks to our speaker, Dr. Ramamurthy ji, and also our moderator ji, for Anurag ji, for making this chat very, very informative and very, very, we have been getting wonderful comments from the viewers. It's very, very informative. Thank you for both of you. Really great. Thanks for your time. And more importantly, we want to thank all our viewers for listening this carefully and patiently, and for their questions they asked, earlier, and also for the questions that they have asked in the chat window. So that really made us, the session very interactive. Last but not the least, I would like to thank a few of the Karyakartas who made this event, successful. The Arunji, our president, and Guru Prasad ji from Bay Area chapter, Srinivas ji, Prakash ji, and Shweta ji for the lot of voluntary work and their cooperation and support. I'm sure all of you appreciate the Sewa's, Know Your Health, the Know Your Healthy Self program. So yes stands for sleep, which Dr. Ramji has spoken a lot about it. I think it is very, very, informative. And also E for exercise, and L for living in the present lifestyle, and F for food and diet. So thanks for giving a complimentary remarks, Dr. Ramji, for Sewa's, this program. And Sewa International will definitely bring many more such interviewing topics, as Dr. Anurag ji was mentioning, in the next few sessions. Please stay tuned for those sessions. And we are tentatively having it for the next 2 weeks from now, December 6th, tentatively. But however, we will confirm you with exact times. So stay tuned till then. And dhanyawad for everybody for watching, and everybody. Thank you.